y'all. I'm Halsey Maddox. I am a board certified sleep physician. I help take care of people who have trouble getting to sleep, staying asleep, or just have trouble with sleep in general. Before we get started, I want to let y'all know that today is for informational and educational purposes only. It does not constitute medical advice or a doctor-patient relationship. And for diagnosis and treatment of a medical disorder, please go ahead and see your doctor. A lot of people ask me what exactly is jet lag, and jet lag is a mismatch of your normal schedule with the expected schedule of wherever you're traveling. So whereas it might be 8 a.m. your time and you're expecting to have a cup of coffee and head to work, it might be noon if you're in a different time zone and they're expecting to have lunch. That's a mismatch of your body, and your body has certain expectations and a certain circadian rhythm, which really sets when you sleep and when you wake. And so jet lag is simply a mismatch between the expected sleep norms and your sleep norms when you cross time zones. Jet lag, however, can have a profound impact on your body. It's temporary, which we are all very thankful for, but it can have a profound enough impact that it actually has its own classification as a sleep disorder, and it's called jet lag circadian rhythm disorder. So that's the big science name for it. What jet lag causes is it can cause headaches, brain fog, abdominal distress, increase in anxiety. It can impact depression. It can impact emotions. All of those things can obviously impact your travel experience. Nobody wants to go into a travel experience and a wonderful vacation with a stomach pain and headache. And so when we think about jet lag and trying to prevent it, what we're trying to do is help your body feel comfortable on a time zone that it's not used to. So a lot of people ask me if they can prevent jet lag, and the answer is you can mitigate most of it. And that's a really great thing to be able to do, especially if you have a big event or a big travel experience or a talk to give or a big meeting across several time zones. It's important to try and mitigate that jet lag. And so ways that you can mitigate that jet lag, one is to go ahead and start to shift your schedule early. And so a lot of people will start 3 to 4 days in advance by shifting their schedule, either by delaying their bedtime an hour or shifting their bedtime earlier by an hour. If you're going eastward, you're going to shift your bedtime earlier and your wake time earlier. If you're traveling westward, you're going to shift your bedtime later and your wake time later. Now, some people cannot shift by an hour, and some people need longer. I have some sleep colleagues that when they're giving a talk in Europe, they calculate the time difference. So say it's 6 hours, and they say, I'm going to shift my schedule by 30 minutes a day. So for them, that's a 12-hour lead for being able to shift their schedules. Now, most people don't have 12 days to be able to shift their schedule because they need to live in their time zone. So typically we say 3 to 5 days in advance, begin to shift your schedule. And again, it's complicated. You have to really think about it. But if you're going to travel eastward, you're going to shift your bedtime and wake time earlier. If you're going to travel westward, you're going to shift your bedtime and wake time later. So that's the first thing you can do. The second thing you can do is really protect sleep leading up to travel. You don't want to go into a travel experience already sleep deprived. So sleep deprivation can cause headaches and belly pain and anxiety and all the things that we think of when we're exhausted, in addition to the brain fog and confusion and just lack of enjoyment. And so you don't want to go into a travel experience with that already happening because you're sleep deprived. So go ahead, plan for your trip early. Make sure a week in advance, have a list of things that you know you're going to need to pack. See if you need to make any last minute runs to the store for toiletries or clothes or things like that. But go ahead and be packed early, at least 2 days in advance. Go ahead and call that Uber and get it scheduled well before you need it. All of those things can really help with your travel experience and preventing jet lag. Now, once you get on the airplane, and we're assuming that you're flying if you're crossing several time zones, once you get on the airplane, stay hydrated, drink lots of water, get up and walk around if you need to. See if you can calculate your sleep time on the airplane and go ahead and try to fall asleep. Take a little neck pillow, get the blanket that the airlines offer, eat a little bit of protein and a complex carbohydrate while you're on the plane or right before you fly. All of those things can help you with getting sleep. Maybe turn the TV off that's on the plane and don't use your phone, but listen to music instead of watching something to really be able to sleep on that airplane. Earplugs also can make a big difference. Now, once you get to the right time zone, once you get where you're going, what you're going to do is if you're traveling eastward, you're going to use sunglasses and you're going to try to prevent bright light in the mornings. And you're going to go ahead and take those sunglasses off midday, eat lunch outside, go on a late morning walk without sunglasses. And then you'll hopefully be able to go ahead and go to bed at the normal time for that time zone. So if you normally go to bed at 10, you're going to want to try and go to bed at 10 that time zone, or maybe 11, maybe just a little bit later. And again, that's for eastward travel. Once you get there, if you're going westward, what you're going to do is actually wear those sunglasses until the late afternoon, and then take a walk outside, expose yourself to that sunlight, and try to go to bed just a little bit later on that time zone if you need to. Or you may end up having to fall asleep just a little bit earlier, and that's okay too. But try to push yourself as much as possible or as late as possible to get to your regular time to go to bed, but on that time zone. Avoiding caffeine and getting exercise also are key. We know that caffeine can stay in your body for 6 to 8 hours. And so, really stop drinking caffeine a good 8 hours before you want to try to go to sleep. And we know that exercise at any point during the day can really impact your ability to sleep. All of those things can really help prevent and mitigate symptoms of jet lag. A lot of people ask me about supplements, and when we're talking about adults, a lot of doctors will recommend melatonin as a supplement, and the timing of the melatonin depends on which direction you're heading. If you're heading eastward, we frequently would recommend just a very small dose of melatonin, probably no more than 3 milligrams, about 30 minutes before you go to sleep. If you're heading westward, we actually time the melatonin in the morning, and that one's a little more complicated. So I don't generally recommend melatonin if you're traveling westward unless you're working with a sleep doctor or a sleep circadian doctor who is able to time the melatonin and your light exposure traveling westward. But traveling eastward, melatonin can be beneficial. If you're having stomach related issues from jet lag, hydration actually can make a big difference with that. And then in terms of supplements, really whatever you do best with. A lot of people will say that Tums can really help them. Other people may say that having just an antacid, a different type of antacid on board, can make a difference. Probably avoiding Advil and Motrin is important if you're having stomach issues, as they can upset the stomach. So everybody always asks me about kids and sleep and travel. How do kids sleep when they travel? And I want to remind everybody that sleep is a learned behavior. Our body learns to go to sleep through routine. So whatever your routine for your children is at home, stick to it. Bring their lovey, bring their favorite book. Make sure you're still doing brush teeth, read a book, get in bed, or whatever it is the routine is for your child. If possible, try to stay on the same sleep schedule in terms of hours and bedtime and wake time. That may not be possible if you're crossing lots of time zones, but if you're only crossing one or two, you can actually just keep your child up an hour later if you're traveling eastward and let them sleep in an hour later, and they actually won't know the difference. They'll still be sleeping on their time zone. So a good example of that is if you're traveling from a central time zone to the East Coast, right? Your child normally goes to bed at 8 p.m. Just put them to bed at 9 p.m. on the East Coast. It'll still be 8 p.m. for them. And you actually would really not change their sleep schedule very much. Now, of course, there are different sensory experiences for children, and children tend to be very sensory sensitive, for lack of a better word. And so when they are sensory sensitive, you have to think about they're sleeping in a different bed, they're sleeping with different sheets, they may be on a blow up bed, they may be sharing a bed. All of those things can impact children's sleep. So this is why routine is so important. Favorite stuffed animal is so important. And also, if they're used to a sound machine at home, go ahead and bring that sound machine. There are going to be new noises wherever you sleep. Those sound machines can really mask some of those new noises. One really important thing for children when you travel is to make sure they are still getting lots of exercise. So, exercise causes our bodies to have the drive to sleep. We break down our energy, and the byproducts of that broken down energy help us get to sleep. That is so important for children. And so, it's really easy to say, oh, we're on vacation, they can watch more movies, we can do more tablet time, and all of that is fine. But one of the things we want to do is really make sure they're still getting enough exercise to have that drive to sleep at night. Still turn off those devices a couple hours before bed. The light that comes from those devices can really impact children's sleep. So while it's easy to say, oh, yeah, we're on vacation, let's stay up late watching movies every night, that can really shift their sleep schedule. So we really want you to go ahead and maintain normal rules at home. Caffeine's another big thing. Children on vacation, they love to get a Coke or some other treat, and that's fine. Keep those, though, limited to lunchtime. So after lunch, really avoid any caffeine for children. We don't recommend any caffeine before age 12 at the American Academy of Pediatrics, but if your child does have caffeine, we do recommend that it be before noon every day that you're on vacation if they're having that. So never let them have it late. And then the final thing is prep your child. Let them know they're going to be in a different place and that it's okay if they have a little trouble sleeping. And let them maybe look at a book depending on their age, or you may end up having to be in the room with them and they may need to know that ahead of time. Sometimes just a little bit of preparation can really make a big impact for your child's sleep. What about jet lag in children? That's the other question I get asked a lot. Sometimes children do travel across 3 or 4 time zones, and it's not realistic to keep them on their regular sleep schedule. Well, for children, we don't actually recommend any supplements. So that's the first question I always get asked is what medicine can we give our child for sleep? And you really can't. We don't recommend any supplements for children for travel as opposed to adults. But children can shift their schedule sometimes. And so typically if you're going to go across several time zones, we would recommend go ahead and shifting their bedtime and wake time by about 30 minutes before you travel every night for about 5 days. So start 5 days before your trip and you're going to shift their bedtime or wake up time by 30 minutes. And if you're traveling eastward, you're going to shift it earlier. If you're traveling westward, you're going to shift it later. But shifting that bedtime can make a big difference. Helping them get comfortable on an airplane. So whether that's bringing a blanket or a pillow, making sure you have snacks. My children used to have to travel on a flight when they were little for about 6.5 hours to see the other side of their family. I always had lots and lots of snacks. Snacks are a game changer on planes. In terms of jet lag, making sure your children are still getting 3 meals a day, that will make a big difference for them. Sometimes it's easy on vacation to sort of get distracted and not be hungry because our time zone is shifted. But for children, it's still really important that they're getting those 3 meals a day and those snacks. And then, like I said, just that exercise is so important for children. So people frequently ask me, how do I get a personalized sleep schedule for travel? And I typically tell them that if you're only going to be crossing a couple time zones, you probably don't need one. It's pretty easy to do. But if you're going to cross several time zones, it is great to work with a sleep doctor or a sleep psychologist who can help you reset your circadian rhythm beforehand and then work with you to have a really good transition home. We do that by actually predicting what your core minimum body temperature is based on your regular sleep routine. And then based on that prediction, we actually let you rent these special commercial devices from us. This is one of them. They look really, really silly. I'm going to show you, but you put it on just like this, and we give you a time to wear it, both length of time and time of day that you're supposed to wear it. And what that does is that actually helps reset your internal clock. You only have 2 ways that you can change your internal clock or your circadian rhythm. One is light exposure and one is schedule. So we help you figure out exactly when you need to shift bedtime, wake up time, exercise time, eating time, and we help you figure out when you need specific light exposure. And making those big shifts when you're crossing 6 or more time zones can be a game changer for how you feel and in mitigating jet lag symptoms.